My name is Ava Tibbs. I'm a junior at Providence High School and the founding president of our Black Student Union. I'm excited to be with you tonight to welcome all of you to our first conversation in our new Providence Connect series. Before we begin, let us take a moment to pause, be grateful, and reflect on our mission statement. As expressions of God's healing love, witnessed through the ministry of Jesus, we are steadfast in serving all, especially those who are poor and vulnerable. Providence Connects is a series of conversations designed to bring insights from the Providence health system and beyond to our Providence High School community. It is hosted by Mr. Scott McClarty, who is our head of school. As a native Angelino who has been in education for more than 2 decades around the country, his focus is on enhancing the student and family experience and creating connections to the wider community and the Providence health system. And our special guest this evening is Dr. Rod Hochman. Dr. Hochman is the president and CEO of Providence St. Joseph Health, a Catholic not-for-profit health system that has served the Western U.S. for 160 years and includes 119,000 caregivers who serve in 51 hospitals, more than 1,000 clinics, and hundreds of programs and services in Alaska, California, Montana, New Mexico, Oregon, Texas, and Washington. The health system also includes education ministries, including Providence High School in Burbank, the University of Providence in Montana, early childhood centers, a supportive housing ministry, and more. Under Dr. Hochman's leadership, Providence St. Joseph Health is transforming healthcare for the future through digital innovation, genomics and scientific wellness, population health, whole person care, and outreach to the poor and vulnerable. In addition, mental health is a top priority for Providence St. Joseph Health, which contributed $100 million to establish an independent foundation focused on improving the mental health and wellness of communities. In 2017, Modern Healthcare named him the second most influential person in healthcare and one of 12 disruptors. He is the chair-elect of the American Hospitals Association and immediate past chair of the Board of Trustees for the Catholic Health Association. Rod served as a clinical fellow in internal medicine at Harvard Medical School and Dartmouth Medical School. He received his bachelor's degree and medical degree from Boston University. Here are Mr. McClarty and Dr. Hochman.
Thank you, Ava, and thanks to everyone joining us this evening. We have students, parents, alumni, partner schools, as well as guests from the Providence Health System and community partners. And a special welcome to you, Rod. Thank you so much for being here for our inaugural Providence Connects.
Great to be here.
Well, let's jump right in. So Rod, I know you get this question a lot, and I suspect it may be top of mind for some of our guests this evening. Why would a health system like Providence have a high school anyway?
Well, as all of you know, the history goes back a long way with the sisters. And, typically they were involved in an education ministry and a healthcare ministry and caring for housing. All were part of what they've done. And we've always maintained the education ministry. And, the most telling question, I was on Wall Street and we meet with our bondholders, and there were a group of analysts that were looking through our portfolio, and they said, we see you have a high school in Burbank. Why do you still have a high school? So you know how the room gets silent and everyone kind of looks at you? And I said, it's really simple. We need to know what the young people are thinking. And I have to say, Scott, it's one of the most, when I've talked to a lot of my colleagues that have visited the school, they always feel it's one of the most fulfilling things that they've done and that they've learned more from the students than vice versa. But I know Aaron Martin, who's the head of our, as our chief digital officer, has loved being with all the students. So it is for us, we're so proud of the school. It's such a part of who we are. And I think it makes us different because we think about what do we have to know? How do we have to educate ourselves? And then, the other side of it is that we love being in an environment in which we can give the opportunity for the students to learn more about science, to learn more about healthcare. That's what we do a lot of, in addition to just being a great place to learn. So it's to us a crown jewel, and one that we've been together for a long time, and we're going to be together for a lot longer.
Definitely. This is our 65th anniversary year, and it's certainly not retirement age for the high school. We've got many years to come. And speaking of high school and your own experience, I know that from a young age you wanted to be a doctor. Can you tell us a little bit about your own high school experience and what impact that had on you?
Sure. I grew up on the other side of the country, born in Brooklyn and lived on Long Island. I was both my parents were immigrants to this country, was first generation, and went to high school on Long Island, Walt Whitman High School. And it was a small school, 10th through 12th grade with 3,000 kids. Uh, but the most important thing was they had a program called Doctors of Tomorrow, where I was able to be with an orthopedic surgeon for the summer, kind of working together, and ended up saying, okay, this is what I wanted to do. And, a lot of in my era, when you were an immigrant's kids, you were either going to become a lawyer or a doctor. So I said, oh, doctor is pretty good, and kind of found that at an early age and never looked back. And from then went on and was part of a 6-year medical program where you get accepted to medical school from high school. Finish your undergraduate degree in 2 years and go right into med school. So it's been now 41 years since I graduated med school in Boston, and it's still the best thing that ever happened to me.
That's great. And 41 years as a physician, I imagine your thinking has changed quite a bit over time about healthcare, about medicine, about the world. At this stage in your career, 41 years in as a physician, what's top of mind for you these days?
Well, it's as much as things have changed. So the science has changed a lot, and I trained as an immunologist, rheumatologist. So the science has really changed. But what hasn't changed, and is the same back when I was a medical student, is what we call the sacred encounter between a doctor and every patient and family that we serve. And I still have patients today that still write me notes 20 years later. And there's, when people ask me what's the best thing about being a doctor, it's that ability to be that close to a patient and family. And when you think about it, when we all think about when we go to a doctor or to go to a hospital, for each individual, it's probably one of the most important events in their lives. So to be entrusted with that there's nothing better than that. So to me, as much as things change, that hasn't changed. But the technical aspects and all of those other things, it's really exciting to see what's happened there.
Yeah, I think it's great that you brought up the notion of sacred encounter, and in fact, the theme for this anniversary year that we chose is sacred encounter, and we think it's particularly relevant to focus on that as the interaction between teacher and student, much like between doctor and patient. And it's all the more important to focus on that in a remote environment, whether we're talking about remote learning or telehealth. Like, how do we think about these remote interactions as sacred encounters? Is that something you've been thinking about?
Yeah, we literally, so as many of in our audience know, we had the first case of COVID-19 at a Providence hospital in Everett, Washington on January 21st. And what was remarkable about the nurses and doctors that cared for this first patient is they knew something was wrong. They did early identification, followed the whole protocol so that no one else got sick. And believe it or not, that first patient got remdesivir because the doctor had worked on Ebola, and they had worked originally remdesivir, which some of you know is an antiviral agent, gets a lot of press nowadays, but had been first used for Ebola in Africa. And he said, well, let's give it a try here because otherwise we're going to lose this patient. Literally save the patient's life. So that for us was, wow, a wake-up event. So for all the health systems in the country, we had the earliest start on this. And what did we have to do very quickly was go to remote care. So both the business side of the health system and the patient side, we went from about a few hundred virtual visits to 14,000 virtual visits a day. So we got to get everyone up to speed. And I think the students and their families can relate to that. All of a sudden, everyone was online. Doctors were caring for patients from their homes, from elsewhere. But we were able to do that within a week. And what was interesting about virtual visits is that there is also a sense of some privacy that you can have because you're talking to that one patient, there's no one else around, you're not in an exam room. So it's been dramatic how much that's changed, probably forever, how we're going to care for people.
Yeah. What's been interesting to me among so many things in the recent months is that on the one hand, we're learning the importance of experts and expertise in immunology and epidemiology and public health. And at the same time, we're experiencing a crisis in primary care, right? And a lack of primary care physicians across the country. Is that something you think about too? Like, how do we balance the need for expertise and specialists within medicine and also just, the ongoing needs, primary care and mid-level providers?
So, our first two messages, particularly for the students, science matters. And science is really important. And the integrity of the scientific method and how we do things is something that I think we've all seen is probably more important now than ever. So that part of it has been something that I have felt good about. And I think the public has gotten reacquainted with their nurses and doctors and hospitals and recognize that those are places of integrity where they can seek answers and seek care. On the primary care side, what COVID has done is really opened up the possibilities. The thing about primary care is it's not, and I'm going to say this as a physician, it's not just about the doctor. It's about the nurse practitioner. It's about the PA. It's about the nurse. It's about the team. And we think there are ways to think about primary care differently. So we're hoping, that we can convince the folks in Washington and elsewhere that there are different models for primary care that can utilize the primary care doctors to their fullest and also, spread the availability of, the primary care practice. We're also hoping to influence, back at my own medical school, I started a scholarship there, particularly to promote primary care, but also to kind of look at the high cost of medical school. And what happens to a lot of students is that in order to pay off their loans, they feel they have to become an orthopedic surgeon, not a primary care physician. So those are some of the issues we're working on nationally. But I think the era for primary care is still yet to come, but it has some exciting prospects in this period as we come out of the COVID epidemic.
Yeah, there are definitely possibilities and opportunities as we look ahead, but it's hard, right? We were talking before we went live, we could look in every which direction in the world and find things that we're worried about, people that we're worried about, issues that seem threatening. And, listening right now are current students and their families, alumni, lots of young people. What brings you hope and joy in the midst of all this, and what advice would you give to everyone listening right now?
So no pressure on the students that are listening, but guess what? I'm banking everything on you guys to fix somewhat what some of us haven't been able to fix. And my challenge to the students are in 5 areas. One, I think a lot of you, and I think the young people, particularly the folks at places like Providence High, are concerned about the environment. So we need more of you to think about the environment, what has to be done. And this year has really highlighted that, between the fires in the West and the hurricanes in the East and everything else. It really calls for some of our smartest, most dedicated young people to really get into the whole issue of how we solve climate change. I think the second area is obviously near and dear to my heart, are the biologic crises, of which the pandemic is here. But there are other worldwide crises in malaria and dysentery that need smart students and folks in their lives to solve some of those problems. Just like the Gates Foundation has been working on things like malaria. So there's a lot of work to do in science, communicable disease, medicine, and biology, which are some great, great opportunities for all of you. The third is just the financial crisis. And how do we help solve the disparities between rich and poor? How do we work on financial models that can kind of spread the wealth? And then we need some smart economists to think that through, that are out there. The fourth area is the whole area, which we may talk a little bit more about, Scott, is the whole issue of racial inequity, social unrest that, I grew up in the 60s and I thought we at least solved some of those issues. And we're realizing we really didn't. And we've got a lot of work to do there. So we need people who are willing to kind of dig in and get at those issues in social sciences and sociology and in government. And then the last one is just the political unrest, right? And the differences between people and their policies. So we need a lot of the students at Providence to get engaged in the political process. And as soon as you're able to vote, I was able to vote in my first election when I was 18 years old, and I voted for George McGovern. You probably don't even know who he is, but I voted every year since I was 18 years old. But I think the whole issue of young people really engaging in politics is critically important. So those are just 5 mega challenges that I think, uh, I only hope that the young people of this world can help solve. And hopefully, I would say that my generation hasn't messed it up too much.
Well, we have our marching orders now then for the high school. Those are big issues, but I'm confident that that we're up for them, and that our students certainly are up for tackling them. And you mentioned racial inequity, and it was really exciting as a person of Providence myself, as a member of this larger system. It was really exciting to see you announce a $50 million investment to address health equity. Can you tell us sort of what led up to that, and how you're seeing the role of the system, including educational ministries like Providence High School, in addressing those inequities?
Right. So, I think it all started for all of us seeing the travesty of some of the injustice that has occurred this year. And I think I think it literally took all of our breath away. But particularly what we did, and, we're in healthcare, so we have to own up to our part of it. And my partner, Dr. Meadows is the president of population health for Providence. And if you really, I don't know if any of the students have met Rhonda, but she's kind of my hero. She's a Mayo Clinic physician, was the Secretary of Health in Florida, Chief Medical Officer for United Healthcare, Secretary of Health in Georgia, worked at CMS, and then, but grew up as a African American woman in Brooklyn, New York, on Medicaid, and was able to accomplish all of this. And she's taught me a lot about her life experience. And we spent a lot of time with all that's happened this year, particularly with my senior group, reflecting on what has been the Black experience in the United States, and really, really listening to our colleagues, not talking, but really listening. And those of us in healthcare have stared at racial inequities for decades and understood, why is there a higher morbidity and mortality rate if you're Hispanic American or if you're African American. And we've kind of stared at the problem long enough. And what Rhonda and I said, this is a time call to action. So instead of kind of staring at the problem, why don't we do something about it? So particularly like with the COVID epidemic, why is it that there's less testing available in disadvantaged neighborhoods, African American neighborhoods, Hispanic neighborhoods, where there's a real disparity in your ability to get the kind of care that you need? So we're looking at across the Providence landscape. We're trying to look community to community. Where do these disparities exist? One of the things, we had a celebration recently in Seattle. Many of you know Mother Joseph was one of the founders of the Providence Ministries. She was also a builder and an architect. She built a hospital in Seattle that exists still today. And we had a lighting of the cross at the top of the building that hadn't been lit in about 30 years. But what was most important about Seattle Providence was it was the one hospital in Seattle that always allowed all doctors and nurses and patients of all colors and beliefs to always open their doors. And that was not the truth in other hospitals that were in the area. So it was really symbolic of the whole issue of equity in healthcare. And it's lived that way for as long as it's been standing. And I think it's a symbol for what all of us who are part of Providence, whether you're at the high school or a hospital or up where I am, that makes us really proud that we've kind of lived who we are for a long time.
Definitely, and we're proud along with you, and celebrated Foundress Week last week as well, and heard all those stories. There, I can never get enough of them. Connected to this conversation about equity is what the system talks a lot about as social determinants of health. So it's not just racial disparities, but also mental health and housing and homelessness and education, of course. So what role do you see for Providence High School and other educational ministries in helping to address all of these social determinants of health? And I suppose that it connects to your list of 5 things for us to focus on, but there just seems like so much to be done, especially in the pandemic, for mental health.
Right. So I think you take it one step at a time, because otherwise it can be somewhat overwhelming. But healthcare, what happens in the hospital or even in the clinic is really a small part of your overall health outcome. And we have a saying, which speaks to it, is that so much of your life expectancy in the United States is based on your zip code, where you live, and what's your access to housing. What's your access to mental health services? What's your access to education? There's a correlation, a direct correlation between education, your level and access to education, and your health outcomes. So all of these other elements are, incredibly important to improve the health of the communities that we live in. If you don't have a place to live, if you're homeless, it's almost a given that your health is going to be as challenged as anyone else. So what we have to look at is, how do we solve for some of the social issues while we're trying to improve the medical things that we know that we can. Part of it is also just what I would say, we talk about the pandemic of COVID, but there were really 2 other epidemics in the United States. One was the opioid epidemic, which we're still in the middle of, which we were battling across this country. And when we look at the number of deaths due to opioid overdoses, in the 40 to 50,000 range, that hasn't gone away. It's out there, but we're so faced with the COVID-19. But the other one, Scott, that you alluded to, is mental health. And that's why when we came together with St. Joseph Health, we committed $100 million to create the Wellbeing Trust, to look at what are the most important issues in mental health, from some of the mild things like mild depression and anxiety to the fundamentally very profound issues in mental health, such as suicide, such as profound depression, that are, really the other epidemic in this country. When we look at patients that we see, almost 30 to 40% of every patient that we see in our clinics and hospitals has a concomitant mental health issue. It's very prevalent. The problem with mental health is, let's go back a little bit. Remember, there was a time when we couldn't talk about cancer, that if you had cancer, you never talked about it as an illness. Then subsequent to that, we talked about HIV, and then HIV became an issue that we now talk about, and mental health is that next place.
That's great, and we're one of our great partners in our own efforts toward destigmatizing mental health, especially among adolescents, is Work to Be Well at the system, and it's really amazing to work with people like Dr. Robin Henderson in supporting our students and developing more programs, in particular during the pandemic, when we talk about physical distancing rather than social distancing. We should be finding ways of being socially present even when we're physically distanced. It can be difficult to do, but I'm definitely convinced that we can do it, especially in collaboration with partners at the system and elsewhere.
Right.
So
it's probably one of the important things that we can do together.
Definitely. Yeah, there's so much that we can do together. And we're supporting the process of Work to Be Well to create new curriculum to bring to high schools, not just in California. And we're the first school in California to partner with Work to Be Well, which is really exciting. And we're just going to see those partnerships grow and expand to the benefit of our students, both current and future.
Because I think for the students, it's such an important area that I was encouraging you, on what are the opportunities to look at all the fields in psychology and social work and mental health. It's a problem that we have to solve. It's probably one of the most prevalent things when we look at, companies that come to us for their healthcare. Overwhelmingly, the number 1, 2, and 3 disorders are mental disorders, depression, anxiety, and a whole bunch of others that we need to be able to unlock, kind of bring out into the open, talk about more readily. And we think some of the virtual tools are actually helpful in mental health because particularly for young people, there's a level of privacy when you're talking to someone, a mental health practitioner, that it's a little bit easier than walking into an office somewhere and sitting in a waiting room. So we're kind of looking at how we do virtual mental health. And in a lot of ways, we're finding, particularly for young people, it's something that they really can relate to.
Well, those are some exciting possibilities. One last question, and then I think we're going to move to some audience-generated questions. So I certainly know that the high school is learning a lot from the health system, especially during COVID. Do you think there are things that healthcare and the system can learn from the high school or from education generally?
Oh, absolutely. So I would say, having the opportunity, and I think Aaron and I talked about that, to understand how this interface between people and technology. And if we want to understand where technology is going, we need to talk to your students, Scott, because they get it. It's such a part of their lives. And, so that part of it, so kind of seeing how they want to relate to healthcare, because it's not necessarily the way I wanted to relate to it or my parents. So really understanding from the students what their ideas are for what healthcare should look like. So I think having the opportunity for our people in healthcare marketing and IT and digital to really have a chance to relate with the students to see what works and what doesn't work in terms of the way they'd like to see healthcare and what are the issues that are there. So that's one. And then I think, we're lifelong learners in healthcare. And what are the best ways that we should be learning? And I know some of the things that you're doing at the high school may be things that we can take away to help teach some of our nurses, some of our clinicians ways to learn that are not our conventional ways of doing it. And that's why we have professional educators like yourself, and to learn from how our students, what makes the most sense to do that. But those are just a couple of areas. But I think a lot of my folks would love to come down, spend time at the school with the students, kind of look at where are some of those interfaces where there are projects and things. We have the Institutes for Systems Biology. Dr. Lee Hood is the president of that, and Lee's probably going to get the Nobel Prize some point in chemistry. And I still learn from Lee every day. I go down to his lab and spend a couple of hours with him. But it'd be great to get him down. He'd love to be down with the students at the school. So I think looking at some of those, you and I have talked about a few of them, but it'd be exciting to do more exchanges between the health system and the students, and both to our mutual benefit.
That's great, and all of your team is welcome, and we'll have more members of senior leaders at the system on Providence Connects, and certainly on campus when we're able to get back. So we're getting some questions from the audience, and the first one is about determining when it's safe for kids to return to school, and what factors we're thinking about, other than just LA County stating it's legally allowable or permissible from a public health perspective. And I can say, you mentioned earlier, it's so important to take science seriously. Well, that's definitely something that's really important to us. And we listen not just to what LA County says, but what Providence Health System is, what our local regional chief clinical officer tells us regularly through email about how things are going. And we also collaborate with other schools so that we're sharing information and best practices on the best ways to return to campus that are safe. And of course, there are other parts of the country where kids are already going back to school. And I don't like to put it this way, but the reality is we get to learn, because we're still remote, we get to learn from the mistakes and the good things that other schools and school districts are doing around the country and around the world. And we're paying very close attention to that. Rod, when you think about the country going back to school, what's top of mind for you? And what would you tell educators across the country, school leaders in particular, are trying to figure out the best ways of bringing kids back?
So I've talked to a lot of college presidents, a lot of directors and heads of school like yourself, and it depends. First thing I always look at is what's the transmission rate of COVID in your community, because the level of COVID in the community is a predictor of how well we could do in bringing people back. If we have, and I can get into the technicality, the science of what the transmission rates are, but if they're sufficiently high, it's almost impossible to control, the spread. The second is, what we've been pushing for a long time, it's getting better, is the availability of rapid testing. So we're hoping that, let's say by the end of this year, that we could have what we call an antigen test. Everyone knows about what we call a PCR test, where you take the swab up your nose. If you have a rapid antigen test where literally before you go to school in the morning, you can tell whether you're positive or negative by a dipstick, that's really, really helpful. A lot of schools have been testing, the water in their school and the wastewater and everything else to see if there's any transmissibility. So I think the second thing that I'm hopeful for is that testing is going to get that much more available, better, and easier to do. Then the third thing is just, what are the smart things to do? Masks actually work. Distance works. You've heard it a million times, but those things actually work. Barriers like shields and masks, but also plexiglass between desks, spreading things out. And then also, as you know, Scott, a lot of folks have looked at hybrid models. So you combine virtual learning with in-place learning. And, the things that are hard to do virtually are things like labs in science and other things. So a lot of us are thinking about how do you kind of mix and match those things. And then, the fourth on my list is what's the social responsibility of all the students? And we've seen it with college students that, you have to practice good COVID techniques all the time. So if you're out, with a whole bunch of friends somewhere, not using masks, you could essentially then transmit and bring COVID to the school. So it's also how do you show up at home? But there's a kind of a checklist, and we've been working with companies to do that. But those are some just off the top. It's even more extensive,
Yeah.
and we've got a number of our folks, both at our health plan and elsewhere, that are working on what are the best techniques to keep people, teachers and students, safe.
Yeah, I think another interesting thing to think about is the difference between bringing back, ECE to third grade kids versus fourth through eighth grade kids and secondary schools, where, oddly, in the spring, it was a lot easier for secondary schools to go remote and to do it quickly compared to, lower and middle schools. But now with going back, it's actually harder, especially given the requirements for cohorting, right? You can
Right.
cohort, you can get 12 kids or 14 kids and 2 adults, and you keep them together all day, every day when they're on campus. If they're on campus every day or every other day to do the hybrid model. But because everything is so interdisciplinary and we have juniors and seniors taking classes together and sophomores and freshmen taking classes together, it's really impossible to cohort at the secondary level and in higher ed. So it makes that it makes going back to school even more risky because you have to be moving around from group to group in order to get to all of your classes.
Exactly. Exactly.
So we have another question specific, more on the clinical side of things for you, Rod. Based on your experience, have COVID-19 patients with autoimmune disorders such as asthma, diabetes, heart disease, thyroid disease been able to be successfully treated? And if so, what kind of treatments have worked for them?
Well, it all depends. So, all concomitant disorders put you at higher risk, right? So, particularly, the area of diseases that I've always cared for have been autoimmune diseases, but cardiac disease, obesity, diabetes are all things that are high risk factors if you contract COVID. The way COVID works is, we're learning a lot about the science. Uh, it really attacks your immune system. And there are two things that happens with your own immune system. One, it can get overwhelmed by COVID. So a lot of people that have autoimmune disease already have weakened immune systems, so they can get overwhelmed. The other thing that happens, and we have not yet understood why it happens, but it can happen in young people, it can happen in elderly individuals, is that the immune system overreacts. And it's called something called, the technical word is cytokine storm, so that it detects a virus, but the immune system overreacts to it in such a way that it actually damages itself. It damages its host. That's why the different therapies that are out there. So we're using antivirals, and remdesivir is in that category of antiviral agents. And then a lot of you have heard about dexamethasone. These are all what we call corticosteroids that suppress the immune system. So what it does is it keeps the immune system from attacking itself. And these are drugs that we've used in things like systemic lupus and rheumatoid arthritis and others, but they're highly effective, particularly in severe cases of COVID. And then some of the researchers have been looking at producing, making the body produce its own antibodies. So that's a third area, and all of those show promise in terms of treatment. The good news is that a lot of people do relatively well with COVID. You can get through it. You produce antibodies. Those antibodies don't last forever, but that isn't necessarily where your immunity is based. It's really based, once the antibodies go away, there's a thing called T cells that then take care of your infection. So in just about 7 or 8 months, the amount of science that's been done on COVID is spectacular. And I've been on the phone with scientists from all around the world, and the amount of collaboration to figure out what the best answer is has been amazing. Uh, So all of those things together, but if you have an autoimmune disease, you are more susceptible to COVID, and we have to take further precautions to make sure that the exposure is limited, etc.
Great, thank you. I want to remind everyone that we are recording, and we will post the recording of tonight's program. I know we've gotten a lot of questions about that. So one final question, and we'll end our conversation. If you, and I ask this knowing that human beings are notoriously bad at predicting, which is why I want to ask it. If you were to make one prediction about where the world will be in 1 year, 1 year from now, what prediction would you make?
So I'm going to preface this by saying I'm an eternal optimist and hopeful. A year from now, we'll finally be leaving the COVID epidemic. And I think we're going to understand how important socialization is and caring for each other as we go beyond that. So I think a year from now we'll be starting to put some distance between us and the pandemic. It won't be gone, which will make a great difference. I hope that we'll have a little bit more understanding on the social side of things, of how we work together. And hopefully we'll see more jobs and more people back to work and all of those important things. And hopefully for the students, the most important thing, a year from now, I hope that you can be back in the classroom and kind of doing all those exciting things that you're used to doing. So I'm looking forward to the time I can get down to Burbank and be with all of you, Scott.
Well, thanks, Rod. You are welcome anytime. We'd love to have you on campus. So that closes out our conversation. I just want to thank everyone for joining us for this first episode of Providence Connects, and a special thank you to you, Rod, for spending this time with us and sharing your insights. Before we sign off, especially our students and families, I ask that you consider what you heard during this conversation and have a conversation about it after you power down your screens. Whether alone or with your family, think about what connected with you, what resonated most with you as you listen, and what will you carry with you into your endeavors tomorrow and beyond. And lastly, I want to thank the team here at Providence High School and our partners at the health system for supporting this program in some extraordinary ways. You can watch the recording of this episode and all of our future Providence Connects programming at providencehigh.org/providence-connects. Thank you, stay safe, and go Pioneers.